Okay. Manju and I are going to kind of co-present. We're going to present a quick overview of COLONTOWN and PALTOWN and why those are two different things. And then talk about a couple of our major programs, ending up with our clinical trials initiatives, which Manju will be taking point on. So COLONTOWN actually predates PALTOWN, which is why it's important to talk about it. So COLONTOWN was founded in 2010 by colorectal cancer survivor Erica Brown, who probably many of you have met. It has a unique model as an online support community. It has a central, what we call downtown neighborhood that all members belong to. And then at the moment, about 120 extra groups beyond that. And those are groups that cover the whole spectrum of the patient and caregiver experience. And each one of those groups is adminned by a patient or caregiver volunteer who is living that specific experience. So if we have a stage 4 care partner group, that everyone in that group is a stage 4 care partner, including the admin who runs that group. So that's true across all 120 groups. PALTOWN is the nonprofit organization that's the umbrella over COLONTOWN, and it was founded in 2016 by myself and Erica. It supports COLONTOWN and all of the associated programs that have grown out over it from it in the past few years. And our mission is to empower patients through education and community, and then to hopefully create additional communities on that COLONTOWN model. This is COLONTOWN today. Actually, this map was created very early on in COLONTOWN's history, and it obviously doesn't have 120 groups on it, but it gives you an idea of the flavor. This is very much the brainchild of Erica Brown that, has this very friendly, almost humorous take on sort of the names of the groups. So as I said, it's 120 groups at the moment. We currently have 5,600 members from all over the world. And we have a training program called Empowered Patient Leaders that most of our admins have gone through. We have a set of community leaders that mentor those admins. We're about 90 admins. And then we have a cabinet that runs the COLONTOWN community. That's 6 patients and caregivers. Lindsay, who's on the call tonight, is our mayor. And then Manju serves as our scientific director, both for COLONTOWN and for PALTOWN. And we'll let, she can talk to you a little bit about what that means. Manju, do you want to take over and walk through the neighborhoods?
Yeah. So there are groups for patients and caregivers. So I'm just going to give a brief overview of some of the groups and how it's organized. These are mostly the patient groups. So we have communities, which is neighborhoods organized around similar topics. So for example, we have ages and stages. This includes, groups for stage 1, 2, 3, and 4 patients. And then we have according to age. For example, we have the Youngstown, which is for patients diagnosed under age 40. We have over 200 members in that group. And then we have the Middlebury Manor for patients over 40. And then we recently started this Next Ballroom, which is for people with no evidence of disease. And then the River Valley. So this is an example of this community. And then we have the Treatment Township, which where the different neighborhoods are organized around treatment. So we have the very simple group, which is a corner cupboard for side effects, dealing with side effects of treatment. And then we have different ones, like for example, the Lars Junction, which is for people with low anterior resection syndrome. Then we have groups like Loney Den and Stivargaville, which is basically for patients who are on specific drugs. Next slide, please. And then we have other ways of organizing it. We have the Maladies, Propensities, and Location community, where we have different groups. For example, the cognitive ways for those affected with chemo brain. Then I'm in this group, Rectalberg. This is for rectal cancer patients. Like that, we have groups for different CRC types. And then we have Met Stadium, which is basically groups organized around the location of Mets. The whole idea being, when you're in a specific group dealing with a specific aspect of CRC, then you have more focused discussion. Next slide, please. And this is, we have our clinical trial neighborhoods, and this is something that is very distinctive about COLONTOWN in that there is a very active, community where we discuss a lot of clinical trials. We have the CRC 101, which is just the basics or fundamentals of the disease. And then we have the main ones are the TONS, MSS clinical trials, because almost, the majority of patients have MSS colorectal cancer. And then we have the different other groups, for example, the RAS clinics for people with RAS mutations. And then we have things like the NIH Lounge, which is for people who are interested in pursuing trials at the NIH. Next slide, please.
Oh, now we're moving to COLONTOWN University. You want me to jump in? Okay. So COLONTOWN obviously has existed for now almost 10 years. And this past year, we really had to get creative, as I'm sure all of you did when we had COVID, because we had our training programs. We have a Clinical Trials Navigators program and our Empowering Patient Leaders program, which is where all of our admins get trained. And we had to do those online. So we created this platform called COLONTOWN University. And once we created it, we decided that we could easily put some additional things in COLONTOWN University now that we have the platform beyond our workshops. So broadly, it now houses our education and training resources. And what we, the nice thing about it is that it is really, really, truly patient-centric. In other words, it is the topics that the patients in COLONTOWN want to learn about. It is content created by the patients. The whole thing is run by patients. And it's been a nice way for us to kind of bring some information in, even from for-profit companies, but put it inside the COLONTOWN brand. And I'll show you how that works in a second. So these are the things that we created to begin with, and we are constantly coming up with new ideas. We call them learning centers, and they're self-contained modules. You can kind of control the membership in each one of these, although they're currently open to anyone. And in each of these modules, we have a range of multimedia content on topics that really were, these first two were the ones that were kind of the hottest topics, I think, in COLONTOWN, diagnostic and surveillance testing and clinical trials. So in each case, we've tried to design the content so that it meets the patient where they are, both in the disease spectrum and in their own sense of disease education. So whether you're newly diagnosed or you've been a patient for a long time, stage 1, stage 2, stage 3, stage 4, hopefully you can pick and choose from the content. And then what we've done is we really borrowed, obviously with permission, great content sourced from our partners, from NCI, from ASCO, all over the place. And then where there is a gap, we create our own content. And then we've gone ahead and reached out to industry partners, and I'll show you how that works. So this is our diagnostic, a screenshot from our intro of our Diagnostic and Surveillance Testing Center. So we always frame what it is that we're doing in the Learning Center. And then we begin with a series of educational pieces ranging from video talks with clinicians to patient design tools. In this case, how do you understand biomarkers and testing options? And then we created a series of independent sections where we worked with some of the companies that have these tests on the market to really walk through what is that test and how is it relevant for a given patient. So this is just a screenshot of some of the resources that we have in that first educational section. And some of these are things like this. There's a great chart from the Global Colon Cancer Association that lists all the current biomarkers and what tests identify them and what the implications are. But then we've also written some of our own content. The COC biomarkers is a great 20-minute video that Manju made. And then we've also pulled in some existing videos from clinicians. And then we went to, as I said, we went to some of the companies. So Signatera is a liquid biopsy test that is now available for colorectal patients, cancer patients. And and it's a very hot topic in COLONTOWN. Should I get this test? Why should I get this test? When should I get this test? I want to get this test. My doctor doesn't want to give it to me. So we really developed basically a content template, and we went to the company and we said, these are the questions we want you to answer. And initially, both Natera, which is the company that makes Signatera, and the other companies we work with were kind of like, well, we have patient education and we have clinician stuff. And we said, nope, we want something right in the middle. We want you to answer these questions, and we'll work with you to pull apart your current content and then reframe it in a way that works for us. And then you can kind of go crazy underneath that and put whatever else you want in there. So they have, in Signatera's case, you can see at the bottom, current CRC studies using Signatera. They have a series of papers and abstracts as well. But this first batch of content, what will I learn? How do I get tested? How can I get reimbursed? What do my results mean? So we asked them to give us a sample test results. You can actually see what that looks like. And then, details to give your doctor is really where they give us their HCP materials. In this case, we're also collecting a list. Didn't fit on the screen, but we're collecting a list of docs that are actually willing to order the Signatera tests all over the country, because actually all over the world, we're beginning to work on that because it's not commonly offered by oncologists. So we did this with Signatera, and then we went ahead and went to a bunch of additional companies, so that when you come to the Learning Center, you can walk through all of the patient created content, the partner created content from places like other advocacy orgs, NCI and ASCO, and then you get into each of these company sections, and they're very clearly marked that this material is provided by the company, but we kind of made them massage it into our format. And then the second center that we launched late last year was the Clinical Trials Learning Center. Same exact model. We're still beginning to build out the content about specific clinical trials, but we did the same thing. We brought together tools to help patients understand the trials ecosystem and to identify trial options. And then we're adding information about select currently recruiting trials, again, in a very clear kind of template that we've designed. So, here you see, like, under clinical trials basics, there's a ton of great material out there about what are clinical trials and why might you consider participating. So we've put that together, but we've added this Finding Clinical Trials a toolbox. So this advice from Dr. Tom is actually taken from blogs written by our COLONTOWN kind of guiding light, Tom Marsillier, who was a lung cancer researcher who some of you probably knew him. He was diagnosed with stage 4 CRC, I think on the day that his drug that he'd worked on received FDA approval on lung cancer. So he's no longer with us, but he was the one that really inspired and set up our clinical trials neighborhoods. And he has some really wonderful kind of advice on how do you think through, just intellectually, how do you understand going about processing your clinical trials options. So we put that in there. We have a whole video about how do you search clinicaltrials.gov, which I'm sure you all know is not that easy. And so these are literally like tips and tricks for how to use the search engine. And then we move into questions from our 1,500 patients that are in the clinical trials groups that they would ask about a trial that you're considering. So I think with that, Manju is going to take us, yes, to you again. I will say that since we started this, we've got about 600 patients now in the university, and we're trying to kind of get the word out for other folks. These learning centers have been very, very successful. We've gotten a lot of great feedback from our patients and caregivers. And so I think next up, we're going to do a whole learning center on that CRC 101 that Manju was talking about. That's currently a Facebook group on COLONTOWN that has just a huge amount of resources, everything from video talks to literally patients saying, here are the 6 things I learned, as I went through my journey, and that if I were starting all over again, this is what I would do differently. And so we're going to try and put all of that in a learning center. And then I think the next one after that will probably be precision medicine, because that's another one of these areas where we're getting bombarded with new tools and options, and patients are really feeling like they need context and they need to understand what these tools can do for them. So Manju, I'm going to turn it back over to you.
Yeah, so this is something that we've been doing recently. So I'm also a patient advocate at the NCI Rectal Anal Task Force. So what has happened recently is that when PIs design clinical trials, they around certain topics, there is so much arguments and discussion over it, and they can't reach a consensus. And they think the topic is really important, but then how to do it, there is so much of discussion, and then things get stalled. So what had happened is that one particular PI had reached out to me saying, this is what they're thinking, and this is what they want done. Like, what do you think? Like, do you think that what would patients want? So then we had a bunch of discussions, and then he had a survey, and which, I and he worked on it, and then we posted in Rectalberg because this was about rectal cancer trials. And then, there was one paper out there about what patients were supposed to say. And the results that we got from our group were much different than what that paper said. So he was really excited about it. And the poll results. So how I did this was that I would do Facebook polls and then kind of tell them what the design was, and then ask people to vote based on their experience, but also imagining that if they were a patient in this trial, what would they choose? So, and then I, kind of gave them the PI, the results of the trial as to what patients were saying. And then they actually took that to the task force and then to the steering committee. And then they were able to kind of get, when it was clear that patients wanted something, then the task force members were easier to convince towards how they wanted the trial to go. So this was, quite exciting. And then since then, I have helped in about 5 or 6 trials. And next slide, please. So this work then we presented to ASCO GI as an abstract, and then it got, selected for poster presentation. So in the end, like, I'm not going to through it, but I'm just going to say this, that when in clinical trial design, when the whole process is done with patient input right from the beginning, for one, it actually shortens the whole inception process of the trial. And then you come up with a trial that is much more patient friendly and, helps with recruitment, and patients are willing to get on it more. So I'm hoping that with these kind of studies, we can convince that, for every cancer, that PIs should, when they have an idea about a clinical trial, that's a good time to reach out to patient communities and kind of find out what do patients think about this trial design. And if it's not something that they are too excited about, then, they can take that input and modify it in such a way that such kind of patient-friendly trial designs help with recruitment and, getting people enrolled and better studies, and, it's good for all of us. Yeah, I think I'll stop with that. Thank you so much for your attention.
So that's it. We're done. We can keep talking, but
Listen,
I thought we'd stop there.
This was fabulous. And I have a question. If you can go back a couple of slides.
Yes.
One of the things that you were sharing around this and kind of the whole university concept, COLONTOWN University, there's obviously a lot of things that are very, very specific to colorectal cancer.
Right.
But there's also a lot of things that are maybe much, would have benefit, kind of on a much broader basis.
Yeah.
Are some of these things that are shareable with the larger community?
Yeah, well, first of all, COLONTOWN University is open, hang on, to everybody. What did I do with it? I had it and then it disappeared.
Do we have to take the GRE to get in?
No, it's free and easy. It's much easier than regular college here. Let me know if you guys can see this.
There's no essay portion either, Stacy.
There's no essay portion.
Awesome.
That's right. So first of all, anyone, and I'm happy to provide the URL for this. We've opened it up to everybody, right? So anyone can come on in here and take a look. But because we're currently serving. I'll just show you something. This is one of my favorite things that I didn't actually show. So this is we call it the Nutritional Label. So this is something that one of our clinical trials navigators put together, and it's like, it's like a nutrition label for your cancer, and it kind of lists all the basic things that you might need to know about your cancer before you, investigate either clinical trials or treatment options. And then it gives you a way to kind of print that out and hand that to your oncologist. I mean, like in a perfect world, we'd make this an app. I really want to make it an app, but I have yet to find anyone who wants to give me $200,000 to make it an app. So if anyone has teenagers, let me know. Maybe we could just do it that way. Anyway, so there's a lot of really unique content in here, and Stacy, you're right. It's a lot of it. I mean, if you just look at like the biomarkers thing, right? A lot of it is specific, but not everything. And the same thing is true in the Clinical Trials Learning Center. I mean, our toolbox content is, none of this is really CRC specific. I mean, even the advice from Dr. Tom, he always described it as getting your planes on a runway to line up clinical trials options. If you look at what he's talking about, it's really not anything to do with CRC particularly. So we'd be happy to, first of all, like I said, all of you are welcome to come on in. I'll share the URL with everybody. But over time, from PALTOWN's perspective, right, as we grow this resource, I mean, it's super easy to duplicate on this platform. I can literally duplicate a learning center with a click of a button. So you could easily stand up a cancer agnostic one, or one for a different cancer, and then just pick and choose those resources that are still relevant, and then add, cancer specific resources as you go.
So I just want to clarify, because I've actually been to COLONTOWN before, and it's pretty specific where it, and I want to always respect this, where it says for colorectal cancer patients and caregivers.
Right.
But what you're saying is that we can actually, as advocates from other cancer spaces, even sign in, and that doesn't violate anything or make anybody
Right.
uncomfortable.
So what we did was we put this on a completely different platform. It's not on Facebook. It's on a platform called Mighty Networks, which is just a commercial community software platform, right? You can have a community about, hairdressing and kangaroos and whatever you want. And the nice thing about that is it's actually built to help people run communities and run workshops, as opposed to Facebook, which is built to suck your advertising data out of you. We have, so for example, we ran our training on here because they have a kind of a workshop session where you can literally do, we kind of launch these modules at different times, and you can have an activity feed, which we turned off in COLONTOWN University. This is, I have no idea what's in here, but these are folks that were chatting, this is a while ago. These are people that were chatting about our training. So you can customize all of this very, very easily. And so because it's separate from COLONTOWN itself, once we turned off the chatter in these two learning centers, because we don't need to moderate it, I mean, we literally just open it up to everyone. So absolutely everyone can join and take a look at these. I will send you all the URL, but I think if you Google COLONTOWN University, you'll find it. It's just here, ctuni.colontown.org, and you go there, and it asks you to make an account, but it's just a free account, like any kind of online thing. And then you will not see the EPL training, because that is, as you can see, it says secret, whereas these are public. So once you join, you'll see both of these learning centers, and you can just go in there. But this platform makes it very easy to just spin these things up and then customize the settings as to whether you want them to be public, private, or secret. And that way we keep the conversation in COLONTOWN, Stacy, as you know, right, very focused on just the patients and caregivers.
Yep.
But we're able to have anybody come and take a look at this content. So that's been nice. And also, our sponsors that underwrite this, we're happy to share that with them so they can see how their content looks. And we don't allow folks like that into COLONTOWN. So you can see we have several different testing, and the Signatera one is actually pretty nice. That they were really good about giving us a lot of content, and you can see it's fairly substantial what they offered in here in the Signatera module. So
Awesome.
Yeah.
Does anybody else have any questions? Because I could ask questions all day long.
Let me know if you want me to stop sharing and get us back to regular Zoom.
Hey, Stacy, I just wrote a question. I can read it.
Sure, go ahead.
Okay. I was lucky enough to know and be a friend of Tom Marsilius, so thank you for sharing about Dr. Tom. And I recall a conversation with him that struck me as you were talking about his own frustration going on clinicaltrials.gov, even sometime after he was diagnosed. And I said to him something along the lines of, if you're struggling, what about us mere mortals? And that got to, again, some of his work and his passion. And my question that I just typed in was, do you, associated with PALTOWN, see challenges in that, hey, you should be in this university? We certainly see on Inspire a number of people who were saying, I'm just a patient, or I'm not going to be on a stage, I'm not going to be at ASCO, and that they, in a manner of speaking, undermine, in my opinion, their subject matter expertise. Do you experience that? And hi, Nancy. And that you and that you just acknowledge that there's some amount of people in that town or in any town that just aren't going to go to university.
Oh, 100%.
And is that okay?
Yeah.
Is that okay?
Of course it is, right? And I maybe Lindsay or or Susan or Manju want to pipe in on this. Lindsay, do you want to speak to that? Lindsay is the mayor of COLONTOWN, so she's really maybe better suited to that question.
I'm having some computer trouble, so maybe can you cover it for a second?
Sure, of course.
Sorry.
So what I would say, John, is that in COLONTOWN, right? So we see COLONTOWN University as an add-on to COLONTOWN, right? And we actually say in the clinical trials kind of intro piece, right? We say welcome, but the best thing for you to do is join COLONTOWN, right? And meet all of our folks. So COLONTOWN kind of has these layers and layers and layers, and there are plenty of folks in COLONTOWN who get psychosocial support, and that's what they're there for, and that's what they get. But we how places have culture, right? So the culture of COLONTOWN has kind of organically evolved over time, starting really with Dr. Tom, to be kind of focused on disease education and clinical trials. And so a lot of people, I think, show up in COLONTOWN not particularly for that reason. And over time, they get kind of sucked into the exciting conversations around these topics, and they get more and more educated and more interested in doing this, because that's what a lot of the folks in COLONTOWN end up talking about.
Okay.
So that's one thing. The flip side of that is we've got a bunch of navigators who are pretty sophisticated with all of these tools. And if you are interested but overwhelmed, help is literally a hashtag away, and we hook you up with folks who are pretty sophisticated and can help.
I got my computer lined out. I just, I think she probably wanted me to answer because I'm like the example of what you describe. Manju's laughing. I was a mess. I didn't know anything about anything. I am not a science mind. I am like one of those artsy people that likes like theater and music, and, and I've worked in restaurant management. Like, I have not been a science person. So when I was diagnosed with stage 4 in 2018, I was a mess. I had 13 liver mets at diagnosis. When they did my scope, I aspirated and was sent to ICU. They didn't think I was going to make it through the night. So I was in the hospital at diagnosis, barely able to get through just getting diagnosed. And I didn't have a clue. And I'm in Eastern Kentucky. I mean, we don't have real hospitals out here. So, my doctor was a mess. He told me I was inoperable, incurable. I just started looking things up online. I found COLONTOWN, and I was scared to post. It just takes a while. So when we bring people into COLONTOWN, we connect them directly with people right away who can answer specific questions to help get them into the neighborhoods they need to be in, and to try and like lovingly, kindly, like be there, So it's like baby steps. Like they had to like baby feed me like the information a little bit at a time. And I would ask questions like, is this what's happening to me? They're like, no, you're way off. You're like this, so they're very helpful. And I didn't have a clue. Like, so I really soaked in as much as I could. And I ended up going to the EPL training and in Boston, and the folks that were there were like, why do you listen to your doctor that you're inoperable and incurable? We have lots of stage 4 patients who have been able to get to resection. So, you need to get a second opinion. And I got educated from COLONTOWN on getting a second opinion. So I did get to NAD, through the guidance of people in COLONTOWN and all of those things. But when I went to my second opinion, I just kind of like exploded all kinds of science stuff that I really like got from Manju. I didn't know these things. I studied up a lot for my second opinion, and then I went in there and I just started spouting things about my biomarkers and what kind of options I could have. And they, it's at a research hospital, so the med student was the first one to talk to me, and he was like, well, you're probably going to have to talk to Dr. Patel about that, because I don't know what you're talking about, so like, it really, like, they baby step at COLONTOWN. We baby step people into what they need and giving them the resources they need. And it's made a huge difference for me, and I know for a lot of other folks. There are a lot of folks also in COLONTOWN who don't necessarily, they might not post their questions, but they've learned how to use the search bar. So they might be more introverted. They might not see themselves as some kind of expert or advocate, but they get the information they need. They'll search, or they'll message one of the leaders and say, hey, I'm having trouble with this. Where can I go? Usually Manju, if it's something that's medical, and she can tag them in the different posts with all the information. So we've developed ways to help different kinds of folks, but they always think it's kind of amusing because I'm out in the middle of nowhere and I didn't know anything about anything when I was diagnosed. But if I wouldn't be here right now if I hadn't had COLONTOWN show me how to navigate getting a second opinion and advocating for myself. Like, I mean, I sat in the office and looked at my scans with my doctor, and it looked pretty bad to me. I didn't know that what he, so I'm grateful. I'm grateful for that. And I know it's like, I'm bragging on my own thing, but I'm just saying that that's my story of how it was so helpful for me. And I just know that patients have different ways of processing the disease, and they have different ways of learning. And this seems to be a way that can fit with your personality. You can communicate through direct messages if you prefer that, or you can post in the groups, or, just different ways to kind of baby people along. Does that make sense?
It does, and thank you and congratulations. And again, at Inspire, we've had people who have sent us a private message after something like 11 or 12 months saying, I've learned and I've learned the language, the lexicon, whatever it was. And that's a long time to learn. And we can see that their activity, and that is really instructive and something that we all need to respect in social networks. So, good on
I'll
you.
say one example that, when I heard about Signatera, I've been posting a lot about liquid biopsies because it's one of my favorite topics. And it's so funny that people will come and read all these posts and they'll go ask their doctor and they'll come back and say, my doctor didn't know, and then we have to tell them that. So now what we do is we tell them about Signatera, and we'll tell them most likely your doctor won't know. So don't be surprised and don't spring it on them. Just say gently, because after reading so much about it in COLONTOWN, they think it's standard of care and they go ask their doctor, and that's not how it's going to work. So it's kind of interesting how people learn, and like I get a lot of messages from people, and it'll be like somebody I have never seen, or we don't even see anything from them, and they'd say, oh, I've learned so much, in the last few months I've learned so much, and now I feel so confident. And it makes you happy, right? That's what we want. So.
There's a couple of questions in the chat, and I know that Nancy's answered them, but I just wanted to, if anybody else was interested, Lillian had asked about the structure, and they are actually a 501c3 nonprofit.
Yep. Yep. We have Susan, who hasn't piped up. Susan and I are the two kind of executive staff, and Lindsay, the mayor. That rounds out our full-time complement. Manju as scientific director, and then we have a host of folks, I don't know, maybe 8 or 9 folks that are on some kind of very part-time contract, helping to run COLONTOWN, helping with a little bit with our back office, that kind of thing. And then I think upwards of 90 volunteers that are all the admins in the neighborhoods. Everybody in the organization except for me is a patient or caregiver from the community.
But you're honorary. You're an honorary.
They've
She's the honorary caregiver for all of us.
They've told me I'm an honorary caregiver, which makes me cry every time they say it. But I don't have lived experience with cancer. So I'm gonna Grace. Manju, do you see Grace's question? You looking at the chat?
COLONTOWN have a way of connecting with physicians and oncologists to connect newly diagnosed patients or people living with colorectal cancer to connect with the platform.
So yeah, we did hand out awesome little brochures for the longest time, and we have run out of the brochures, and we're having a ferocious internal debate about, do we make more brochures, because right now no one's handing anything out in doctors' offices, right? And so I think we're actually launching a attempt to get better SEO and use our Google ad grants and all of that to, to reach people online. But Manju has an amazing presence on Twitter. She has a huge following in the CRC oncology world. And so we do have like a bunch of COLONTOWN friendly doctors, some of whom are very prominent CRC, practitioners and investigators, and they all know about COLONTOWN and they send their patients. But a lot of it is word of mouth, one patient to another.
Can I put in a vote for go with the postcard still? Because
Yeah.
so many
Yeah.
people aren't on social media, not on, and some of them will never get there. But
Right.
I do know that, oncologist's office passing out something as easy as a postcard, it's coming from a trusted source for them.
Yeah.
That's
Yeah,
smart.
I think we do need to do it, even though, we used to get like requests from oncology nurses and clinics every week to send them a stack, and we're not getting those requests. But I think, right, I mean, you're right, Grace, like colonoscopy centers and all of that. So another question that Lillian had was, how are we funded? So we do get grants from pharma, like probably a lot of the 501c3s in this space, but we're just over 4 years old. And in the last year, we have seen a tremendous increase in private donations. A lot of our donations come from families who lose family members and want to give back because of the experience that they had in COLONTOWN during that process. And they will often launch on their own, sometimes first launch it and then come back and tell us that they've launched it, donation campaigns. And we have one caregiver that last year who launched a donation campaign in memory of his wife. And he's closing in on, he's well over $100,000 that he's raised all by himself. We're not doing it at all. We're supporting him a little bit logistically, but and that was a surprise to us. We thought we were going to be mostly grants, and it's really been the community members themselves, not necessarily donating their own dollars, but they are the ones that are networking and fundraising. And then we're also developing, sponsorships with companies. So COLONTOWN University, we've gotten a bunch of corporate sponsorships to help support that project. As an example. We do accept money from pharma, right? We write grants, but most of the time it's grants to support educational activities. They support our EPL training that Lindsay went to. That's our leadership training. They support our navigator training. I've written a couple grants for COLONTOWN University. I'm sure that we'll be able to get pharma funding for our learning centers, because that's the kind of thing that they like. They like, when we say, how about you support all of our community leaders that are volunteering so much of their time? They say, no, we don't pay for people, but if you want to run a workshop, we'll write a check for that. The people that support the people are other advocacy groups. So we've gotten support from the Colon Cancer Coalition for our community leaders. We're working with Fight CRC on a bunch of projects. But pharma, they want like an agenda, right? They want the workshop with the agenda. So
So I know that we've only got a handful of minutes left, but I did want to ask the question that's been on my mind around extending this model. And I know, Nancy, you and I had talked a couple of years ago with PALTOWN. Is that still on the agenda? Is it?
It's very much on the agenda. We grew a lot in 2020, right? Both in terms of, we now have, if you go on our website, we have our staff page has I've lost track, 12 or 13 or 14 people on it, which is amazing because a year ago it had 2. And we've been able to execute on, there's a lot of other programs going on that we didn't talk about tonight. We have a huge amount of programs going on. So we've really achieved with especially with bringing on Lindsay and the folks that work with her, and then Manju as sort of, proper staff to manage the COLONTOWN community. So that's really sustainable. We're now, I think this year is the year that we can look at expanding. And so the whole point of PALTOWN was to kind of make sure COLONTOWN thrived, and then to go on and do it again, right, in other disease spaces. And for those of you who've started nonprofits, you can't do that right away because you're struggling to survive. But now we're not struggling. And so I think this is the year we're going to do that. And so our biggest questions are, platform because I personally do not ever want to use Facebook again, but not everyone agrees with me. And we've done some internal conversations. And so that's a whole thing. And then the second thing is what disease space? And I am always open to conversations about that. So, you know, what we learned in the CRC space, which, you know, because Erica started this when she, just as a sort of labor of love as a survivor, not intending necessarily to make it some big enterprise, right? It grew very organically for the first number of years. And, but obviously if we start with deliberation in a new disease space, you know we need to have a very collaborative relationship with the other advocacy orgs in any disease space. We don't want to come in and seem like we're competing with them for grant dollars or donations or somehow undercutting their programs. And so that's a process we need to be very thoughtful about. And we need to, and I think there's going to be some disease spaces that will be more amenable to that than others. So
I agree with you. And you know, for those of you who don't know me, I'm an advocate for all cancer types, but you know, I'm a breast cancer survivor, and you know, breast cancer is renowned for having organizations that can't play nice together. So,
breast cancer, that's the number one, not going to go there list.
Yep, yep. And so one of my thoughts is
So true.
Yeah.
That's why we're striking that one probably off the top of the list.
Yeah. But one of my thoughts is there's two main components to what you have, and this COLONTOWN is huge, right? I mean, huge. And Lindsay gave a very personal story of what it's meant to her, and I have friends who mean similar things to them. But then there's also this concept of the university.
Mhm.
And to me, that's the piece that I think is really, with very few exception, missing across all cancer types.
Yeah.
And so, and just thinking about how you build those relationships and how you know, try not to piss people off and still add something of value and aren't redundant and all of that. I really
Right.
think there's huge opportunity there.
That's a really helpful perspective, because I have to admit, I don't know about everyone else on the call from COLONTOWN, but I hadn't really thought of it that way, that could be the leader. And, you know, a lot of these platforms allow you to build in community around, right? So the content that you saw, we could have live conversation I mean, it's a button I could push. We just didn't do it because we didn't want to have moderation issues outside of COLONTOWN. But that might be, I mean, I really had never thought of doing it in that order, but we might, because COLONTOWN University was new, you know, 6 months ago, we just came up with the idea. So it wasn't planned really. Thank you. That's a very cool idea.
Yeah, so this is really exciting. I can tell you, I heard about COLONTOWN probably around 2010 from Joellen DeLuca,
Mhm.
right? So she would carry around her little map of COLONTOWN,
Yep.
and
That
she
was the
would
same
show it
map.
to everyone. So I just really, it's really nice to see how much it's grown. I know it meant a lot to her and still means a lot to her. So
Yeah.
I think that, you know, it's just really good. But I agree with Stacy. I think the university is really unique and the platform is really unique. And that's something that people are just like dying for. And I think if you can bring colon cancer orgs together, you can bring anyone together.
Yeah, it's actually worked
I
out
think
pretty
it's,
well.
yeah. And I
yeah,
think it's,
yeah.
you know, I think every group has their little niches, like lung and breast, and everybody has their little factions. But
Right.
if you can start with one and bring together, I think you can do anything, I think.
Yeah, I mean, last year in particular, right, we, you know, the Colon Cancer Coalition came to us and said, we really love that, you know, you're trying to kind of give everyone jobs basically, right? And we want to support that. So they gave us a grant they told us what to say in the grant, like, please write this and then we'll give you money, which was great. ICRC was a partner with us. I didn't show you the Clinical Trials Navigator workshop, but similar to the other one. Just because the account I was using doesn't have access to it. But they collaborated with us on developing that program, and they had folks from their research advocacy group participate in our Navigator program, and we're doing a blog series together with them about clinical trial stuff. So that's actually, it took a little while, but that collaboration has really taken off. And so we are hopeful that we can go to a new disease space and sort of bring that model forward and say, you know, this is how we can enhance what you're doing, you know, with what we're doing and work with you. So
That's great.
We'll see.